Write a short note on Giardiasis. Morphology. Cyst stage of Giardia. Cysts are the infective form and are excreted in feces. Infective form excreted in feces. Oval or ellipsoid in shape. Oval or ellipsoid in shaped. They have a thick, durable, translucent wall. They have a thick, durable, translucent wall. They have a thick, durable, translucent wall. Thick, durable, translucent wall that helps protect the parasite in a harsh environment and conditions. They have a thick, durable, translucent wall. They have a thick, durable, translucent wall that helps protect the parasite in harsh environment and conditions. Inside the cyst, there are usually two nuclei. Inside the cyst, there are usually two nuclei, four flagella, hair-like structures for movement. Cysts are the infective form and are excreted in feces. Cysts are the infective form excreted in feces. Oval or ellipsoid in shape. Cysts are infective forms excreted in the feces. Oval or ellipsoid in shape. They have thick, durable, translucent wall that helps protect the parasite in harsh environmental conditions. They have thick, durable, translucent wall. They have thick, durable, translucent wall that helps the parasite that helps protect the parasite in harsh environment and conditions. Inside the cyst, there are usually two nuclei. Inside the cyst, there are usually two nuclei and four flagellas. Hair-like movements for movement. Hair-like structures for movement. So cysts are the infective forms. They are excreted in feces. They are ellipsoid or oval in shape. They have a thick, durable, translucent wall that helps protect the parasite in harsh environmental conditions. Inside the cyst, there are two nuclei. Inside the cyst, there are two nuclei and four flagella, hair-like structures for movement. Then the trophozoite stage. Trophozoites are the active, motile, and feeding stage of Giardia that exist in small intestine. Trophozoites are active, motile, and feeding stage of Giardia. Active, motile, and feeding stage of Giardia. Trophozoites are the active, motile, feeding stage of Giardia that exist in the small intestine. They are pear-shaped or teardrop-shaped. They are pear-shaped or teardrop-shaped. They are pear-shaped or teardrop-shaped. The trophozoites are pear-drop-shaped or pear-shaped. They have two adhesive disc ventral and central, that allow them to attach to the intestinal lining and resist peristalsis. Trophozoite stage have two adhesive disc. Trophozoite stage have two adhesive disc, ventral and dorsal, that allow them to attach to the intestinal lining and resist peristalsis. They have two adhesive discs that allow them to attach to the intestinal lining, intestinal lining and resist peristalsis. Trophozoite stage have two adhesive discs that allow them to attach to the intestinal lining. They attach to the intestinal lining with these two adhesive discs and resist peristalsis. Trophozoites have two nuclei and four pairs of flagella. Trophozoites have two nuclei and four pairs of flagella, making a total of 8 flagella. So trophozoites are the feeding stage. They are the active motile feeding stage of Giardia that exist in the small intestine. They are pear-shaped or teardrop-shaped. They have two adhesive discs, ventral and dorsal. They have two adhesive discs, ventral and dorsal, that allow them to attach to the intestinal lining and resist peristalsis. They have two adhesive discs that allow them to attach to the intestinal wall and resist peristalsis. Trophozoites have two nuclei and four pairs of flagella. making a total of 8 flagella. Ingestion of the Giardia cyst. Giardia cyst का इंजेक्शन होता है, ड्यूडेनम में एक्ससिस्टेशन होता है, जियार्डिया सिस्ट का इंजेक्शन होता है, फिर उस सिस्ट का एक्सिस्टेशन होगा ड्यूडेनम में. एक्सिस्टेशन से ट्रोफोसाइट्स आर रिलीज्ड एंड डिवाइड्स बाय बाइनरी फिशन. ट्रोफोसाइट्स रिलीज होते हैं और बाइनरी फिशन से डिवाइड करते हैं. फिर ट्रोफोसाइट्स का इंसिस्टेशन होता है, सिस्ट फॉर्म बनते हैं विच आर एक्सक्रीटेड इन द फीसेस, और फिर उनका ट्रांसमिशन होता है. जियार्डिया सिस्ट का इंजेक्शन होगा, फिर उसका एक्सिस्टेशन होता है ड्यूडेनम में. जियार्डिया सिस्ट का इंजेक्शन होगा, उसका ड्यूडेनम में एक्सिस्टेशन होता है. ट्रोफोसाइट्स रिलीज एंड डिवाइडेड बाय बाइनरी फिशन. एक्सिस्टेशन से ट्रोफोसाइट्स रिलीज होता है और वो बाइनरी फिशन से डिवाइड करता है. ट्रोफोसाइट्स का इंसिस्टेशन होता है, सिस्ट फॉर्म बनता है विच आर एक्सक्रीटेड इन द फीसस, एंड देन उसका ट्रांसमिशन होता है. तो जियार्डिया सिस्ट का इंजेक्शन होता है. दैट्स वाई cyst stage is the infective form, and these are only excreted in the feces. Cyst form are excreted in the feces, फिर उसका ट्रांसमिशन होता है. Giardia cyst का इंजेक्शन होगा, फिर उसका एक्सिस्टेशन होगा ड्यूडेनम में. Trophocytes are released and divides by binary fission. फिर उन ट्रोफोसाइट्स का एंसिस्टेशन होता है, cyst are excreted in the feces, फिर उनका ट्रांसमिशन होता है. So this is the structure of the trophocyte. They have sucking disc. This is the sucking disc. This is the nucleus. It has two sucking discs, then nucleus, and then four pairs of flagella. That is total of 8 flagella. Four pairs of flagella. That is total 8 flagella. It has nucleus and sucking disc. Okay. This is the sucking disc. This is the nucleus. ये जो है, this is the axonum, this is the flagella, and this is the parabasal body. So trophocytes has sucking disc. Trophocytes have sucking disc, then nucleus, axonum, flagella, and parabasal body. Sucking disc, nucleus, axonum, parabasal body, and trophocytes. This is the structure of cyst. This is the cyst wall. Then this is the axonum, and then the nucleus. Cyst wall, axonum, nucleus. Clinical features: asymptomatic. These people are carriers of the pathogen. Asymptomatic people are the carriers of the pathogen who release these cysts in the feces but themselves do not manifest any of the symptoms of the disease. So asymptomatic means they will be the carrier. They will not show any manifestations. They are the carrier of the pathogens. They release the cyst in the feces but themselves do not manifest any symptoms or signs of the disease. Asymptomatic people, they do not manifest any symptoms, but they are the carrier of the pathogens. That is, they will release the cyst in the feces. Acute giardiasis symptoms include diarrhea, bloating, abdominal pain, bloating, and diarrhea. Acute giardiasis, the symptoms are abdominal pain, bloating, and diarrhea. Then steatorrhea, it occurs due to fat malabsorption. Steatorrhea occurs due to fat malabsorption. There is malodorous plate, sticky stools are released in the feces. There is malodorous pale sticky stool released in the feces. There is malodorous pale sticky stool released in the feces. Malodorous, pale sticky stool released in the feces. Chronic giardiasis, this is due to persistence of infection. This is due to persistence of infection and include foul smelling diarrhea. Due to persistence of infection includes foul smelling diarrhea flats along with extraintestinal manifestations such as urticaria interior uveitis and generalized weight loss. Urticaria interior uveitis, urticaria interior uveitis and generalized weight loss. Clinical features may asymptomatic. These people are the carrier of the pathogens who release the cyst in the feces but themselves do not manifest any symptoms of the disease. Acute giardiasis. The symptoms include diarrhea, bloating, and abdominal pain. Abdominal pain, bloating, and diarrhea. Steatorrhea. Steatorrhea is due to fat malabsorption. There is malodorous, pale, sticky stool released in the feces. There is malodorous, pale, sticky stool released in the feces. Malodorous, pale, sticky stool released in the feces. Steatorrhea is due to fat malabsorption. There is malodorous, pale, sticky stool released in the feces. Chronic giardiasis. This is due to persistence of infection and include foul smelling diarrhea flats along with extraintestinal manifestations. The extraintestinal manifestations in chronic giardiasis is urticaria interior uveitis and generalized weight loss. Urticaria interior uveitis and generalized weight loss. Urticaria interior uveitis and generalized weight loss. Chronic giardiasis, this is due to persistence of infection and include foul smelling diarrhea flats. It is due to persistence of infection and includes foul smelling diarrhea flats along with extraintestinal manifestations such as urticaria interior uveitis and generalized weight loss. Urticaria interior uveitis and generalized weight loss. The clinical features can be asymptomatic, acute giardiasis, abdominal pain, bloating, diarrhea, steatorrhea, steatorrhea due to fat malabsorption, malodorous, pale, sticky stools. Chronic giardiasis is due to persistence of infection and include foul smelling diarrhea flats along with extraintestinal manifestations such as urticaria interior uveitis and generalized weight loss. Urticaria interior uveitis and generalized weight loss. Laboratory diagnosis of giardia. Stool examination में a fresh stool sample is collected from the patient. A fresh stool sample is collected from the patient. Wet mount. The sample is microscopically examined for the presence of giardia cyst or trophozoites. The sample is microscopically examined for the presence of giardia cyst and trophozoites. Concentration techniques such as sedimentation or flotation may be used to increase the chances of detecting the to detect the parasite. Stool antigen test or coproantigen. Stool antigen test or coproantigen. Enzyme immunoassays and immunochromatographic assays are used in this method. coproantigen में enzyme immunoassay and immunochromatographic assays are used in this method. Enzyme immunoassay and immunochromatographic assays are used in this method. They detect specific giardia antigen in the stool. In molecular methods में polymerase chain reaction tests are highly sensitive and specific for giardia diagnosis. Serological test includes ELISA and IFA. Culture in diamond medium, these are done for research generally. In diamond media is done for research generally. Duodenal aspirate or biopsy done using enterostring test. Duodenal aspirate or biopsy done using enterostring test. Duodenal aspirate or biopsy is done for duodenal enterostring test. Duodenal biopsy or aspirate is done for enterostring test. Duodenal aspirate or biopsy is done for enterostring test. duodenal aspirate or biopsy is done for enterostring test. In severe or chronic cases of giardiasis, when other diagnostic methods are inconclusive, and endoscopic procedure may be formed. In severe or chronic cases of giardiasis, when other diagnostic methods are inconclusive, then an endoscopy procedure can be done. A sample is collected directly from the duodenum. A sample is collected directly from the duodenum, which is a part of the small intestine most commonly affected by the giardia. Diamond media is done for research purposes. Duodenal aspirate or biopsy is done using entero string test. Severe या chronic conditions में endoscopy procedure may be formed, and a sample is directly collected from the duodenum, where a part of the small intestine is which is a part of the small intestine most commonly affected by giardia.